whatever to stand up, a chronic neck, a chronic back, a chronic shoulder, a chronic wrist, something that you can demonstrate to people. Okay, if you got a chronic whatever, stand up. That's it? One person? Remember I asked, are you going to play full out? So if you ain't playing full out, where else does that show up in your life? I just stand up. You. Come on up. You. Yeah, you.
Good.
There's a reason why I didn't pick the rest of you. I'll get to the rest of you possibly in a second. So come on up on stage. So we got all of our product here. I'm going to show you the power of this product and how fast it works on the nervous system. What's your name? Hi, Jan. I'm Roland. Nice to meet you. Give her a hand. Make it feel warm. So understand, what I'm going to demonstrate right now is how quick the nervous system responds to seeing that the nervous system is the #1 controlling system of your body. The energy field controls your nervous system. You get that? The energy field, that's what we do with bioenergetic synchronization technique. We clear that. But the nervous system is the #1 controlling system of the body, then it'll go to the hormones and the circulation. We're going to show you how fast Jeff's products work on the nervous system. Now, we live and die at the cellular level, so it's going to take some time to get those cells detoxified and then rebuilt and revitalized. That's where your people need to know. It's going to take 3 to 6 months. It's going to take some time. And if they don't like that, move on and call them in a month or two. All right? So what's going on with you?
Oh, from the beginning? Oh, I've got fibromyalgia, I've got chronic pain, but my neck, my low back.
Okay, so she's got fibromyalgia, she's got chronic pain, neck and back. Okay? So who's heard of muscle testing? Just raise your hand. I'm not going to do it.
Wow.
No. I'm going to do demos, but I'm not going to do muscle testing because all the other people in the audience have no value and have no context to understand muscle testing. But I'll tell you what, if you see her range of motion change, and if she tells you she's not in pain, would that get your attention?
Yeah.
If you don't get jazz and want to say hallelujah at the end of some of these demos, what are you doing here? Because that's what's going to happen. And I'm not hypnotizing you guys. There are people on stage. There are people who come on stage and they purposely say and do things to hypnotize you, whether you know it or not. And it's happening on television. Doogie Howser, House, Grey's Anatomy. Are you kidding me? Private practice? You think there's any health in a drug? Keep you alive for a little while, but there's no health in a pill. You didn't get back pain because you have a lack of those pills in your diet. And you don't get cancer because you have a lack of chemo in your diet. You get it? Okay, so let's see. Let's take a step up here because I want to show them what's going on. So turn your head to the side. Just turn, not tilt, turn. You can see she's limited in range of motion, yes? Turn your head to the other side. That's not as bad, but she's still limited, okay? So what I'm going to do is I'm going to have you turn your whole body to the side, and I'm going to look at shoulder. Well, I can already see. Let's see if these guys can see. Turn to the front again. So you can see that, okay? So you can see postural changes in her. Let me ask you, is it her conscious mind that's controlling her physiology right now?
No.
I got in trouble last week when I said talk therapy really doesn't work. It was a psychotherapist that I was talking to. Because her daughter had pain in her hip, and they'd been talking about it, and I said, well, it really doesn't work, does it? Because you still have the pain! I got in trouble. That's okay. She left the practice. All right, so what I'm going to do is just allow me to raise your shoulder, and I won't push it past where it's not hurt. Okay, let it relax. I'm not going to go past there, because that's as far as she can go, relax, on passive range of motion. She could probably force it. The rider could force the elephant. You get that? But there will come a time when the rider, the conscious mind, will not be able to force it anymore. And again, I've worked with Olympic athletes, celebrities, professional athletes. They've got everything that you think you want, and they have a disease and they messed up their relationship. it's not about that conscious mind. Okay, turn your head to the side, but you got to learn how to use your conscious mind. Okay, so just let it go. Just let it drop. Now that one is raising more, right? You can see that. So I guess that's a bad arm. Isn't that what people say? They come in and go, my bad kid, my bad leg. You see what I'm saying? There's no bad. There's no wrong. This is perfect physiology right here for some stimulus locked in her brain.
And these muscles are always in spasm.
Okay, so let's take a look at those muscles that are already in spasm, like right there. Like right there, it hurts. Okay, and I'm just going to touch your hips for a second. And sort of like right there too. And that one. Okay. Get personal. Okay, so what if?
Sorry, Jim.
This is your husband right there?
He's recording us.
Oh, my wife's over there. So where'd she go? She's recording us. Okay, so you need GO Max right now. So let me thank you, Deanne. So I'm just pour for yeah. You
Shake it up.
Yeah. It's down at the bottom.
Sorry.
So what we're going to do is I'm going to show you how fast the GO Max changes not only the neurology but also the energy circuits of the body. If we could get 20% range of motion improvement on her, would that be a success?
Yes.
It would be an absolute success for medical terminologies and physical therapists. We might get more. I'm underselling. I'm going to over-deliver. Okay? So what I want you to do is you're going to just have a drink, get a little bit down, and then leave a little bit, and that little bit you're going to keep it under your tongue, and then I'm just going to have you walk up and down stage, just on the stage a few times. Okay? Just get the first one in there, and then we're going to keep the second one under the tongue. Good. So it's not bad, right? It's tame.
I like
Okay?
it.
Oh, we like it. Good. Good. Now keep that under the tongue and just walk up and down on stage. Just walk. So what I'm doing is we're putting change into her nervous system, and we're helping her nervous system integrate. Duchess, there you go. You know what strutting your stuff is about. Good. Okay, now you relax. Now come on over here. I'm going to stand over here for consistency. You can swallow that. You can get that in your digestive system. So what I want you to do now is just turn your head to the right side. That was the left, but that's fine. Look at look at what happened to her neck. Do you remember that?
I do.
She does.
Yeah, there's only like about there.
Yeah, so turn it. Good. Now turn the other way.
The other right?
Yep, the other right. Good. Relax. So that's good, correct? So her range of motion in her neck is already improved. Turn to the side. What about this shoulder?
Hey, there's no pain? I'm not kidding.
I'm not kidding. She's qualifying you. Have I ever met you before?
No.
Maybe in a past life?
No. Do that again.
I'm pushing hard enough to cause tissue damage. We just collapsed your paradigm. Okay? We just collapsed it. For a way of seeing. Okay, just let this relax. I'm just going to go nice and easy.
Wow.
There is. Well, there's a little twinge there.
Yeah! Can everybody say backstroke? Relax. Nice and easy.
I've had a lot of pain with this shoulder for a long time, huh, Jim?
Yeah, but your neck surgery too.
Yep.
How many weeks?
5 weeks. Nothing.
Wow.
Come on, I don't have any. Let's do those ones. Do that one on the hip. Just do that up here for them.
Nothing.
What about this one?
The one that I yelled at before?
Yeah, the one you yelled at. It's turning. They're thinking he's not poking hard.
Oh, no.
I'm poking hard enough to cause tissue damage at this point. Give her a hand. Awesome.